You are all welcome welcome to IOSH West Africa North Central District CPD meeting. My name is John Afangbe. I'm the chair of the North Central District. IOSH West Africa North Central District is one of the 4 districts of IOSH West Africa branch. This CPD event today will afford us IOSH members the opportunity for professional development. And for those of us who are not members of IOSH on this call, this meeting will provide us occupational safety and health knowledge that will be for public benefit. Today, we have a seasoned scholar in the person of Dr. Julius Akpong. He is to discuss the challenges and opportunities of occupational safety and health practice in West Africa. Dr. Julius Akpong is a seasoned professional. He is currently the head of Quality Health, Safety and Environment for Egbin Power PLC, which is the largest power generating plant in West Africa. He's a sterling QHSE and corporate sustainability professional with over 18 years of experience across oil and gas, power solutions, aviation, and consultancy sectors. He's a fellow of the Emergency Crisis and Risk Management Institute and a member of the American Society of Safety Professionals. He's a certified member of the Institute of Occupational Safety and Health at IOSH, and he's a fellow of the Institute of Safety Professionals of Nigeria, ISPON. He's also a fellow of the Global Institute and member of the Chemical Society of Nigeria. Dr. Julius is a doctoral scholar and international tutor with the Doctor of Philosophy in climate change and environmental sustainability. In fact, he's a man with many caps. And today we are in a very safe hand. He is currently a volunteer of IOSH and chairman of the IOSH Career Mentoring Committee and Director General with the Center of Excellence for Innovation and Leadership. Ladies and gentlemen and fellow professionals, join me today as we welcome Dr. Julius Akpong to talk on the challenges and opportunities of occupational health and safety practice in West Africa. Dr. Julius, you're welcome.
Thank you very much. The pleasure is mine. Just a moment while I share my screen. Okay, can we please confirm we can all see my screen?
Yes, we can see.
Yes, I can see from here.
Thank you very much and welcome everybody. And thank you once again, Mr. John Afangbe, for inviting me. And the entire IOSH North Central crew. Thank you for your commitment to health and safety. The job I've been given to do is simple and not simple. Simple in the sense that it's to talk about health and safety within our operating terrain. Not simple in the sense that my personal discoveries of things that are the challenges and opportunities challenge me personally. So let's run through this together as we look at this subject holistically. I had stated in the abstract, the brief abstract I submitted, that there's been an acceleration of the future of work, and that this acceleration had been brought about by the emergence of COVID-19, which was such a very bad and yet good pandemic that befell us in both professional and private spaces. So that really accelerated what we used to know from a distance as the future of work. A lot of companies didn't know that they could do so many things from home. But COVID-19 forced us to think about how to do it, and we eventually did. And well, a lot of people are still working from home till today. And a lot of companies have been forced to save so much from this. So in West Africa, we have had our fair share of different things. We have had the introduction of fresh hazards. So we'll run through this from the brief introduction I'm already doing. We'll look at our realities, and then we'll look at the challenges and opportunities that are bound. So for us in West Africa, I mean, our continent, our subcontinent is interesting in many ways. We have unique people, we have diverse cultures, we have very, very, very good food, very nutritious food, and many religions, and we're also very religious. And then we have diverse languages. Our geography is in itself very, very unique. Unique in the sense that what in some places will be connections between people, in our own cases is distortion between countries. So what in some places will be distance between a state and the other will be distances between one country and the other. And what in some places will just be a movement from one state to the other will require a visa just to cross from, one place to the other. If not that the ECOWAS passport has now made it a lot easy. So in the course of my research, I stumbled on some jobs, some good works, research works on ResearchGate that were done by Asuzu and colleagues. And just while I was trying to look at the history of occupational health and safety itself within the region, I found out that our region had not really had interest in that, and this was occasioned by the type of culture we ran, type of food and religion that we had, in the sense that we believe that a lot of things were spiritual. We believe that even workplace accidents were spiritual, and people had to make sacrifices to the gods where people were excessively getting injured at work or were dying at work, and certain acts were seen as acts of God. So there was really no point making a lot of noise about them. But the first organized effort to boost occupational health and safety practice for the Africans, among Africans, and involving mainly Africans, came actually in 1960s. That is precisely around 1968. And that was the first African conference on occupational health that was held actually in Lagos, Nigeria. The health and safety in industries in Nigeria has, however, not been in any way adequate. Even after those efforts that were made, it's not been adequate. And this is the reason why a lot of studies in that area, especially among indigenous small and medium-sized companies, showed that that growth was really, really slow. And this is easy to see in some of the practices I will be showing in videos on these slides. You can see people still driving through flooded roads. These ones are occasioned not only by occupational health practice, but also by the economy, the politics, the people, the culture, and practices. You can see people hitching rides on dump trucks. You can see a lot of container trucks falling on vehicles and unsuspecting citizens, boats capsizing, buildings collapsing on people, fires, outbreaks in different regions. You can see the poor occupational health and safety practices in the public taking rides on overloaded trains. You can see that in even the young ones being exposed as they're overloaded on motorbikes. We can see people hitching rides on by the side of moving buses, and different types of road workplace incidents. Also, as you can see in these brief GIFs here, these are clear. And then there are also researches I stumbled on, which also gave up the fact that while occupational health and safety accidents are on a downward spiral in most of the developed world, that they seem to be on the increase within the developing world because efforts that are being made to prosper these economies and grow the people are leading to a lot of projects which are not carefully planned with regards to occupational health and safety. And this is giving rise to a lot of incidents. Not to bore us with too much with data, I just picked a few countries, and what you will see here is just road traffic crashes in Ghana, in Nigeria, and in Mali. In Ghana, for instance, you can see that total vehicles that were involved in accidents in the period under review were 22,025. Then 13,645 were reported, and then 13,677 people were injured in those cases, and over 2,000 were killed. What this tells you, and this was just between a period of a couple of months, about 3 to 4 months. What this tells you is that a lot is happening. Of those 2,000, of course, the greater percentage were male, over 1,700, and 554 were women. So, and it's known that in most parts of West Africa, the most active working population, which are most exposed to workplace-related hazards, are the male population, which are also being touted as being lower in terms of demography than the women. This also has its own issues because it exposes the population to a shortage in male population occasioned by the efforts being made to grow the country's GDP, grow families, and lead the development effort. You can see that in Mali, the figures seem to be going down from 2012 to 2019. And this one is a case of a small country that seems to be making some efforts, even though not so strikingly significant, but some effort is being made, and it is showing up easily because the population is actually not so much. But in Nigeria, I had to take time to reel out the data in more detail. And you can see here that within the period under review, I think this was 2012, thereabout, no, or 2020, you can see speed violations, sign light violations, wrongful overtaking, all the road incidents and violations, which show a poor penetration of occupational health and safety practices. Now, why is it assumed that public behavior on the road has connection with workplace health and safety? This assumption is made as a result of the connection between what is done at the workplace in terms of leading indicators, providing training, how that affects people's attitude. And these people are a part of the general society. So when you grow them and improve them from the workplace, it shows in the way things happen. Please note that that is not the only factor. The availability of legislation and its enforcement is also a point. It's also an item, to look at. So, but in Nigeria alone, in 2021, within the power sector, you can see the data there. The data is not funny at all. It shows there that there were 31 deaths, 9 injuries, and 9 injuries from 39 incidents in the fourth quarter alone of 2021. There were 30 deaths and 19 injuries from 49 reported incidents, reported being the key word because a lot of them would also have gone unreported in Q3 of 2021. Between January and September of 2021, that is the Q1 to Q3, 80 people were killed by electrocution due to different exposures. These are issues that the proper presence of an occupational health and safety culture practice within the region can really help solve. I mean, not minding the fact of dilapidated infrastructure and a lot of other contributory factors, which are also based on the result of a generally conceived poor occupational health and safety practice. So Q2, the Nigerian Electricity Regulatory Commission report in 2019 lamented that no fewer than 3 persons were electrocuted every week. And this is terrible to hear. Between January to November of 2022, 82 people had, in fact, last year alone, over 114 people were killed in that same sector. Now, the prevalence of workplace accidents in West Africa workplaces are a very significant concern, particularly in construction, manufacturing, and mining, where we even managed to have a few figures. I mean, some of the key insights are the fact that occupational injuries are said to be increasing from about 69% upwards. In fact, contributing factors to injuries, factors like temporary employment, parts of which we call gig working, and or labor engagement, part-time labor engagement, and the lack of safety training are key contributors to workplace injuries. And then the absence of PPEs, because a lot of companies see it as too much of an investment. And since legislation is not so strong in pushing through that area, people get away with these things. And that leak is allowing the statistics to go up too high. So these statistics show us a very critical need for an improved occupational health and safety practice within West African workplaces. There is a need to protect families because also, like I said earlier on, our reality is the fact that one human being in a West African workplace is equal to 10 human beings in the West African society. Why? Because we run a culture where people are dependent on the people who go to work. That means that whoever is working is paying school fees for a poor or indigent relative who lives with them. He's taking care of his own children, and we're used to having a lot of children. I mean, it makes us happy to have a big population. We can't be held liable for that. But the issue is that that is making one individual who has all this population indirectly depending on them to be more than just one human being. And what it means is that if one of them is injured at work, that community is injured. This translates a lot into how elections are conducted because people are going to accept to sell their votes to politicians to be able to cater for that population. People are going to accept a lot of things they shouldn't do just so that they are able to get those means of livelihood. What it also means is that when these people are killed in workplaces and their benefactors, I mean, their downlines, those who depend on them, are not able to get sustained by they don't have by the fact that they don't have a benefactor anymore. What happens is that they end up on the streets and they are going to do anything that comes their way, including lifting ballot boxes, including theft. So this increases the security issues while decreasing the gross domestic products, terribly affecting income per capita and reducing the potentials for these economies to develop alongside the rest of the world. So these are some of the very negative realities that happen within our West African workplaces. And this is the case from the biggest of them, which is Nigeria, through Togo to Ghana, Mali. All the countries within the region pass through the same reality. And I have visited one of the, about 2 or 3 of the countries in the last couple of months, and interviewing cabmen, just the people who carry me from the airport to my hotel room, I find out that all of them seem to be waiting for a giant, Nigeria, the giant of Africa, to take a leap so that they can all follow suit. About 3 or 4 cab people, I mean taxi drivers, 2 of whom were graduates from renowned universities, told me that if only Nigeria can get it right, they will all, instead of running away to Western countries, to Europe and America, they will all be coming to Nigeria, and it will be easier for them since movement within the sub-region is visa-less. It will be easy for them to transfer development to their place. Are they wrong? In some instance, maybe. In another, maybe not. So our realities is that we have weak legislations. We have a very robust culture, which in itself does not allow health and safety to grow, even though it's a very rich culture. But the cultural practices some of the cultural practices. I can tell you that in one of the countries, there is a goddess responsible for headache. And that goddess, when you have a headache, instead of taking drugs or looking for a way to rest, you have to consult that goddess. Some ritual has to be performed on you for the headache to go. You know, poverty is one of those strong realities across the sub-region, and it's increasing exponentially these days because economic policies are not favoring the growth, and food security is tailing down. The politics is that politics of godfatherism, where the rich keep getting richer and the poor, the opportunities created for the poor to come up out of poverty are diminishing on a daily basis across the sub-region in a very, if you look at this from, in my research, I looked at countries out of the sub-region, and I even see some growth in places like Rwanda, even in Tanzania, because of some of the antecedents of John Pombe Magufuli. There seem to be growth, more growth in some of those places. But in some of the places, growth is happening, but it's not commensurate with the size of the population. So it's not the absence of growth in the politics as is stated, but is the less than average commensurate states or rates with which the growth is happening that is not allowing populations to grow as they should, because some of the indices put in place to help them grow are against some of the jobs. So this was very deep because I found out that corruption used to be an income earner for some people. So even when you try to put some measures in place to tail corruption, in some cases that diminishes some other person's income. So it means that a certain level of overhauling careful overhauling needs to be done to allow for genuine growth, even if it goes back and begins again. But that has to be deliberate and has to allow for a period when the people suffer these downturns and begin to grow. Whether we have started that trajectory in most of the West African countries is still to be known. But hunger is real, and it's a reality, and it's one of those things that are affecting our occupational health and safety practice. Because I find out in my personal research that hunger has created new hazards in the workplace. There are new hunger-related medical treatment cases. There are new hunger-related first aid cases at work, which we all need to. There are new hunger-related restricted workday cases, which we all need to look at and begin to, when you are identifying hazards within your workplace and looking at pre-task considerations, we all need to add these things because they have been occasioned by our reality. Legislation across, OSH legislation across West African workplaces. In Nigeria, I just took two countries here. In Nigeria, we have the Factories Act 2004. We have the Employee Compensation Act 2010. We have ILO conventions, and Nigeria has been profiled on the ILO on OSH. We also have a poorly detailed national policy on occupational safety and health. Well, Ghana has the Labor Act 651 of 2003. Ghana also has the Factories, Offices, and Shops Act of 1970, Act 328. Because of mining activities happening in Kumasi and some other parts, we also have the Mining Regulations 1970, Law 1 of 665. And then we have the National Policy 2 on Occupational Safety and Health for Ghana. But if you go out of West Africa, you see that South Africa is developing so many robust standards and legislations, which I think in no distant time, they will just be like the health and safety executive in the UK, because I mean, their legislations are getting really, really strong. So this, again, I mean, if you look across all of these legislations I just mentioned, at best from Nigeria, for instance, you can only look at the ECA of 2010, which I think is most recently more detailed. As for the rest of them, and then of course the ILO conventions aside, otherwise the rest of them require a lot of build-up to come up to reasonable documents that we can look up to and feel that we are covered on that side. So it's important that these are our realities in terms of occupational health and safety legislations, and it's important that we do not look at them only from the negatives, but that we look at them from what can we do. So don't look at all of these things I'm saying as the doomed part of us, but look at them from the point of view of, okay, as West African people, how can these challenges or how can these realities and our challenges become the positives? Okay, so few more challenges, and I just carefully chose 6 of them. So the first one being the fact of the large presence of an informal economy where we have vulcanizers, we have plumbers, we have carpenters, we have iron workers, different sets of people. A large portion of the workforce works from this informal sector and is often largely unregulated. It lacks proper safety measures and makes it difficult to enforce our occupational health and safety standards and to be able to monitor compliance. A lot of times, if you even have to discuss anything by way of enforcement with these people, all the politicians like to do is to give them incentives and palliatives, and so that because they are the lowest chain, they can help in the next campaign. So at best, this is what they are used for. Regulating them is something that has hardly been thought of. However, the ILO organized a meeting using a platform called SASASnet. The earliest part of this year, that meeting was organized in Ghana. The aim of that meeting was to bring all of the operators of this informal economy into a process, a framework, and I was one of those invited for that meeting. We were invited to help see how West Africa can bring this large informal economy and its operators into a fold where they can all be certificated to grow through the ranks into becoming directors in disciplines where they are directly involved. That framework has been formed or is being formed by SASASnet in conjunction with all other countries and development partners within the region. I believe that very soon a big announcement is going to be made so that if you're a vulcanizer, you can grow through the ranks, even to become a safety professional who can train people on safety processes in the vulcanizer job. Same with other people, auto mechanics, electricians, and the rest of them. So that's an effort that is ongoing. But limited resources are also another challenge because many countries in the region are struggling with inadequate funding and resources for occupational health and safety programs. Now, I must say that in my research and in questioning people in the right places across board in government and private establishment, the poor funding is not because of the absence of funding. It's because of the large and huge presence of mismanagement of these funds as a result, again, of our political predispositions that, within the sub-region. And that has caused a lot of problems in places like Ghana. I mean, I use Nigeria and Ghana a lot, maybe because these are the 2 countries within the region where I have visited the most. And I find out that in most of the cases, it has not been the absence of resources, but it has been the ability to manage these resources effectively to achieve, the necessary gains. So it includes insufficient trade.
We cannot hear you again, Mr. Julius. Dr. Julius? I think the presenter is having some network issues, so he's going to be back in a moment. Please, the presenter is coming back in a moment. We can begin to drop our questions on the chat box and the comments also, so that we can take them immediately after the presentation.
This is one of the challenges. I guess this is one of our challenges here. Apologies. It just kept slowing down until it went out. So I'll turn off my video. Maybe that will save the bandwidth and allow it flow smoothly till the end. Apologies. Okay, so I'm sharing my slides again. Okay, host, if you can enable that. Mr. Afambe. Okay, so I'll just continue while we're getting that set. So I was talking about the challenges and I had talked about the large informal economy.
Okay. The doctor, please, it's done now. You are now
all right. Thanks. Okay, I'll handle that now. So I was talking about the large informal economy and how also the reduction in resource availability has almost crippled the OSH practice, how that has been impacted, you know. So, but the third point I'd like to look at is the lack of awareness and training. And all of these factors have their own impacts on occupational health and safety professionals who work within the space. And I'll come briefly to that before we round up. So the lack of awareness and training is often that lack of awareness and training about occupational health and safety among both employers and employees is still a big deal. I mean, in very few companies, you see that even those owners who had worked in good organizations where they got very good exposure to health and safety, when they establish their own organizations, they don't want to do it to the letter because they are managing out of their meager resources, and they seem to value their economic impact over and above occupational health and safety. That in itself is a lack of proper awareness, because the right awareness will tell you that an accident will claim all that profit you're trying to get. So it's in itself a problem. Then weak enforcement from legislation of even the few available legislations are not properly enforced because of the lack of political will, the presence of corruption, insufficient penalties for non-compliance, where some people would like to break the law and pay for it rather than look at, I mean, companies are in the UK and US, where, I mean, we know that even in the UK and US, it's not perfect, but at least it's far above what we do this way. So at the end of the day, the penalties there, when you think about them, when you think about the fact that you will be asked to do negative publicity against yourself by yourself and all of these things, you want to avoid, you want to take the best possible means to avoid it. But because of corruption, all this, oh, my brother is the one in government. I mean, the wrong things are beginning to be the right ones around here. And these are some of the things that call for a lot of attention. And then poor data collection, inadequate surveillance and reporting systems, which just mean that many occupational injuries and diseases are going unreported. I mean, they rush the people to the hospitals. I have been on sites in so many places where an accident happens and they hide the victim. They don't want safety to see the person. They don't want it to be part of statistics. Maybe because they don't want to break the records. They don't want to lose compensation. They don't want to look bad in front of their colleagues because of different types of betting they are doing and all of those kind of things. And then, of course, there's poor data collection. And I will tell you that about 8 years ago, as an individual, I set up a system to start collating data for health and safety, workplace incidents regarding health and safety. And it's not as easy as it looks at all. I praise countries where this has become a norm. Even there are the reporting is still not perfect, but then it's far, far, far above what we do here. Data collection is still not where it should be. I know that NSITF, through a no-fault system that it operates, is getting some data. The Federal Ministry of Labor is getting a few data. The Nigerian Electricity Regulatory Commission is getting some, but all of this data is scattered. If I want to do a research now to get incident data from Nigeria that were reported last year or the years before, it's really difficult to get holistic data that you can analyze to establish trends that will help you begin to arrange solutions to these problems. So that's where I say the data collection is still very, very poor. So the reporting systems are not there. And I mean, where they exist, they still allow opportunities for the people to lie about what happens. And it hampers a lot of efforts to understand and address occupational health and safety issues. So I already talked about this. This challenge of economic constraint is big. It's very, very big. There are high levels of poverty, economic instability, which can lead to prioritizing immediate economic gains over long-term safety investments. So if an MD thinks about his organization, he will put minor cosmetic approaches in place just to achieve some immediate financial benefit, rather than establish a firm system, rather than employ a competent occupational safety and health practitioner who would put a firm system, a good system in place. And you can see the poverty lines and inflation rates, which show in no means that, generally speaking, we have enough balance in the economy to begin to grow. Although this is just between Burkina Faso, from Burkina Faso to Togo. Nigeria, for instance, is not here, but this gives you across the sub-region what you would say an approach, an idea of what inflationary and poverty statistics are saying, and how this tremendously impacts professional practice for health and safety. Why doesn't this affect a lot of other professions? This is because Medicine and surgery, for instance, is being looked at as something you must do. Even when you don't do it, when you get ill, you eventually end up in a hospital. So at the end of the day, there are factors, natural factors, bringing people to that profession to make it viable, as against ours that people look at as something I'll do after I've finished doing the important things. That's how most people refer to our profession, is what we do when we finish at attending to the main things. And that again owes itself to a lack of understanding. So, but all of these challenges have opportunities. Number one, and greatest opportunity is the fact that by the time we begin to address these multifaceted challenges, everybody can find an advocacy point. Everybody can hope to develop an NGO or something to begin to raise awareness. By the time you look around all these challenges I've highlighted, occupational health and safety professionals who are well-read, well-trained in these areas can take up areas of advocacy and begin to raise advocacy. And of course, there will be challenges in that too, but that's why we are occupational health and safety people. That's why passion is the highest qualification for health and safety practice. The passion will push you to do these things. And because the developed world do not need such approaches, because they already have a system that works. But here, you need them. If you develop a small advocacy group, even on WhatsApp, you will have a lot of people. If you get up on your street where you live and start an advocacy, you will get an audience, and you gradually begin to affect things one way or the other. So there is need to improve legislation that we cannot do individually, but we can impact the government to do, to increase funding, to enhance training programs, and raise awareness about the importance of occupational safety and health. I have been to places where I spoke about occupational safety and health when I was asked, what is your profession? And I said, so people didn't know what that meant. It means that there's still a lot to be done. And if the safety culture of a place, like I posited in one of my write-ups, if the safety culture of a place or an organization is the collective intelligence of the people that work in that organization, it means that in any people, among any people, among any workplace population, it means that in any sub-region or country or local government or state where the culture of health and safety there is poor, it means that it is the collective intelligence of the people that work within that organization. What this means is that for those of us who know about these things, we need to seek to improve the amount of intelligence within these places by improving safety education. That in itself is an opportunity. If you see it the way I'm seeing it, it's a big opportunity because it will allow you to implement a safety culture. That means that when you move through the workplaces, through the streets, through the landlord and residency associations, you will seek to improve leadership. And as you do that, it will help to set up systems which will help support the right behaviors within an organization and within a workplace. As you do that, you will improve people's behavior and help them to perform the right behaviors. You will be able to engage people, community dwellers, and employees actively to involve them in making valuable contributions. And then you will help the people to have positive perceptions of themselves, their co-workers, their neighbors, their organizations, so that they are willing to always go over and above the call of duty to protect humanity and other human beings. When you do that too, you will help to improve workplace conditions, the physical conditions of the environment, to improve interactions of equipment, facilities, procedures, and people, so as to allow a safe performance. When we do all of these things, because of that, everything will culminate gradually. It will evolve. It won't transform, but it will evolve gradually into a safer society. More of the opportunities that have been developed is the fact that COVID-19 allowed the opportunity for gig working, where people don't necessarily have to go take up jobs in organizations and sit in there and work as they are anything and obey all rules and be be confined to work within that organization alone. But on your own, you can work for 5 companies on your own, sitting at home. You can work for 10 companies as a gig worker. But you manage your own personal economy, your taxes, everything, your own health. It has its own disadvantages, but then it's a reality which we cannot run away from. And in Africa, I personally have up to 20 friends who are into gig working. And anytime they are tired, they refuse to take any jobs. They just go and rest. One told me not too long ago, gave me a job. I said, please go and help me handle this. I'm not interested. I want to just have some family time for 1 week. And with gig working, you can do that. But when you work in an organization, you can't do that. You have to take leave. And if your leave periods are over, and the organization can still call you, excuse me, even when you are on leave. So, but when you are a gig worker, you own your leave periods, you own your work periods, you own your money. When it finishes, it finishes. And these opportunities are bound now in West Africa. Given our challenges, you can do all of these things. You can set up squads to achieve, to ameliorate those challenges by being a gig worker. And it can help you grow at your pace. Consultancy is rife across all sectors. I just talked about the fact that hunger has become a new pre-task activity that we need to do before contractors are coming to your site to work. You need to be sure that they've eaten, because the economy takes away food from people and allows some of them to do 001. And as far as, I mean, I have had such cases where I've had to rescue people from site. They collapse on site and were rushed to the medical center. And I've had to go there and say, okay, doctor, have you checked everything? Doctor says it's okay by medical indices, but he's not opening his eyes. And I said, okay, can you leave me and this guy in the room? And this has happened for like 3 to 4 cases. And I say, okay, can you leave me and this guy in the room? And inside, while I'm alone with those guys, I just say, okay, what I'm going to do now is to buy you food. And if you can just open your eyes and tell me what you want to eat. Is it hard, or is it something soft, or you just need something to drink? Since the doctor has confirmed that medically this guy is cool. And then they come across and they tell me what they want. And in these cases where I've provided these meals, the guys have eaten and gotten back from that bed and gone back to work. So at the end of the day, it's consultancy. When you are called to a place to carry out a risk assessment, look around the environment for one reason or the other, these are things you need to include in your hazard identification. These are things you need to include. Occupational health risk management needs to also look at people's health from the point of view of economic exposures, which are allowing some deprivations. You know, people are no longer as nourished as they used to be. So because of, because their purchasing powers have been reduced. So this allows the presence of those new occupational health related hazards. Employers are also cutting costs. In their bid to do so, they will not also buy certain things. So you can see exposure to certain levels of chemicals in some workplaces, which will impact occupational health risk as a result of that economic issue. So this is an opportunity for occupational health experts. There is a need for digital transformation. It makes, like those who are into gig working, when you have digitally transformed, you can do, sitting in your room, you can work for 2 clients, having meetings with them, real-time inspections, and all of that. So digital transformation is an opportunity we all need to harness into advancing our course as occupational health and safety professionals. Now, this last, second to the last one is funny, but politics. I advise occupational health and safety professionals to get into politics, and I'll tell you why. In Nigeria, new laws are currently being made for health and safety to legislate health and safety in Nigeria. A board for regulating health and safety is currently, that bill has passed 2nd reading. Notable safety and made their mark and insisted and wrote this piece of legislation and ensured that these legislations are now coming to life. Sometimes you will ask, do we need to get into politics to do that? But getting into politics is in different areas. Some go to the mission by giving. Some give to the mission by going. So there are different ways of doing it. You either go there by giving, in any case, supporting people who have gone there so that they can listen to you when you arrive. I mean, or you actually give to humanity by volunteering yourself. You know, so these are, I mean, opportunities that exist in this region. Policy formulation. We all need to actively get into formulating policies for managing occupational health and safety. So if you are an expert in construction, begin to, I mean, these places where policies don't exist, it's easy. Begin to formulate these policies and bring them up for consideration. Bring them up for consideration. There are different professional bodies. We can utilize these avenues to implement these things. So these are, in my opinion, and from the brief research that I did in this, these are the opportunities I feel abound for health and safety within West Africa, and a lot more. But within the time and space available, these are, so I mean, those of us that are here can add more, but these ones are some of the ones that quickly come to mind, and from questions asked are very readily available that we can all hope to harness. You know, very, very important. So I think that this is where I will leave it. And thank you very much for your attention and the opportunity to do this. Thank you.
Thank you very much, Dr. Julius, for this fantastic, would I call it a presentation? No. Would I call it lecture? I think if there's something between lecture and presentation, I think this takes it. The North Central District Vice Chair will be handling contributions and questions. Vice Chair, you have the floor.
All right, thank you, Mr. Fatu. Thank you so much, Dr. Julius, for that insightful session. You have really impacted us with knowledge that we need to go back to our various bits or location to start advocating for health and safety. That's one key takeaway from me. So at this point, we'll be welcoming questions from participants, and I can see a hand is up this afternoon, and that's Mr. Jason Kamalu. Please, you can unmute to ask your question. Followed by Mr. Fatu.
All right. Thank you very much, Mr. Julius Akwong. That was a great and powerful presentation. I know Mr. Julius personally, and he's not only a senior professional colleague to me, but I'd say one of my mentors that influenced my career early in the days. So Julius, thanks for that presentation. I really like the high level analysis you gave to the challenges and macro issues bedeviling the OSH practices here in West Africa. I just have two questions. I think one of the questions I wanted to ask is with respect to institutions of occupational health and safety, you know, in the region. So my question is, what effort, how can OSH institutions or professional associations within the region, how can they help to improve occupational health and safety practices in West Africa? And then the other question I have, if I'm allowed to ask to, is with respect to passion. So one of the things that you said, you know, us professionals need with respect to the practices is passion, you know, and I do agree with that. But my question is, how can how do you think OSH professionals can manage that passion? Because unsustained passion without support can lead to burnout. So how can we manage that passion and be very, I'd say, effective in our influence on the practice within our local areas? All right, thank you very much.
Okay, thank you very much, Jason. I mean, really good to hear you again. Well done. It's very refreshing to hear from you again. And thanks for continuously attending these sessions. You remind us that we all need to step up. Well done. Okay, and these are very insightful questions. And you see that I carefully avoided that aspect of the presentation, because I could easily have said that Ghana has a safety professionals association, and Nigeria's own has even been chartered by an act of the Federal Republic, and that these ideally speaking are supposed to be very, very interesting platforms to advance the cause of safety professionalism within the sub-region. Actually, I had expected that by now, that synergy across safety professional associations within the sub-region, within the West African branch network, would by now have reached a level where we can talk interstate, intercountry, and be able to, crossbreed whatever we have this way to the other side and make things work faster. Actually, those associations have such capability, but they are also currently bedeviled by what seems to be the challenges within the sector. The poverty within, poverty, people always see it as people in rags, and poverty, someone can be poor in a car. Someone can be poor wearing a big jacket and sitting down somewhere. And when that poverty comes from his head through his mouth to the people, these things have a way of, downturning things. You look at IOSH. IOSH is run by human beings and groups of people who are, growing in several ways. And these our own associations are also run by human beings and people growing. A lot of us very, very intellectually minded, but a few of us also, I would say, for want of a better word, not so intellectually minded, and I would say criminally minded. And that has a way of putting a lot of people down. So you see a lot of genuine professionals will run away from such associations, and we need those people so that the places can grow. So my advice would be that if you think you are a strong safety professional, join a safety professional body and do your best to not run away. Let the presence of, they say evil thrives when the good people keep quiet and walk away. So prevent that evil from thriving by staying put and ensuring that the good thing happens. And then this, on your second question, was about passion and how it might burn out if there's no motivation. That's true. Now, I grew up, maybe I was very lucky growing up. I grew up knowing about the mirror therapy. And so there was this situation where each time I wake up and I'm not in the mood to go out, I was taught to go in front of a mirror and say, "This is me." It is not the circumstances that I have exposed myself to that make me. It is the me in me that makes me. And these obstacles that make me this demotivated, I am going to overcome them today. So I go out every day with a renewed passion that anything that is so lucky that I am passionate about it will not in any way be brought down. So every morning, I don't wait for anybody to motivate me. I don't wait to be told the good things or the right things or for the right things to happen for me to get motivated. Instead, I look for people to motivate. So I would like to advise us, most of us, that when you see what you have liked and you are passionate about, like some of us are about health and safety, develop an opportunity to always go all out to make it happen. But from our environments, some of us who are at least in places where people are listening to us, we keep talking every day. allow this practice to flow so that the younger people can be happy to do something about it. But until that happens, please stay motivated, encourage yourself, be like people like Jason, who even after they have left this continent are still contributing from wherever they are. Thank you.
Thank you very much.
Yeah.
Thank you so much, sir, for the response to Mr. Jason's question. I'll be calling on Mr. Fatiu now to either ask his question or contribute. Thank you.
Thank you very much, District Vice Chair. And this is extending the thanks to Dr. Julius for his fantastic presentation, lecture hybrid. So what I just want to say is that I would like to pick up from the last part of your answer to Jason Kamadu's questions. Yeah, the work we do, I think it's been fueled by passion. But most importantly, what I just want to highlight here is that for you to give to somebody, you must feed yourself. Well, what do I mean? The Yorubas will say, you don't give from an empty point of view. You have to be filled up yourself. That's when giving is cool. In our little ways, we have professionals here. We have upcoming safety practitioners like me. You need to make sure you fill yourself. What do I mean by filling yourself? Knowledge-wise, there are 1,001 resources online that are free. Most of them are paid. You just need to know what you are looking for, and every day make sure you fill your heart with knowledge. Then there are opportunities as well to immortalize ourselves. That's what we are doing in this practice. There's an avenue to make money, but that is just tip of the iceberg. Avenue to immortalize yourself. I think that's a selfish way of looking at it. Yes, making your marks in the sands or in the rock of time, such that your name will remain immortal. What do I mean? There are lots of avenues. We have PTA meetings, we have resident association meetings, whereby we can make small, bit by bit contribution, not too much, but slightly towards occupational health and safety in a way that people will resonate with. Take, for example, now, for PTA, for example, now, I'm sure people will not want to listen, but there are ways. I think we discussed this at this North Central presentation the last time, which is how we can advocate for occupational health and safety in our environment. We can do a lot. We can do a lot by actually infusing that. There are some people that will not want to agree with you. Take, for example, I've had cases of whereby in my area we're trying to make talks about, okay, we need to beef up security. Somebody is saying, I don't have things that can be stolen. I just have to wake him up. I said, but if you don't have properties that can be stolen by thieves, but you have children that can be kidnapped, all of them are almost the same. I just need to say that it's not as if I meant it, but in a way to bring him into the reality to know that you do not have something that cannot be stolen does not mean you are not involved. You are involved one way or the other. So we should be able to call attention of people, to know that, oh, this person that is doing this work, though might not be related to us, but it's our neighbor. If he dies, just like Dr. Julius said in his presentation, one person is like 10 person in our society. If he dies one way or the other, the children, the wives, they become our responsibility one way or the other, even though we might not like to listen to that. The children that you don't take care of, they become miscreants in the societies, and it affects us one way or the other. So in a way, we should be able to think that, okay, the little I'm doing by putting these words out there in a way is slowly permeating people's consciousness to awaken them to the fact that no, we'll get to practice OSH as it's supposed to be. If you look at the flow, according to what Dr. Julius have taught us in the past, is that the way you see, there are reasons why we practice occupational safety and health. Some will say moral, fiscal, and probably maybe legal. But there's another precursor to all this is the society expectation. It is until we expect this as a society that this is what we need to do, that is when the legislation will pick up and other things, other reasons will now fall into place. If we don't do this, you understand, it's not expected of us to know that our neighbor or a human being like us is not supposed to get injured and die as a result of carrying out a job or going about his means of livelihood. Until we begin to have that feeling, until we begin to have that talk, until we begin to put that in people's subconsciousness, we are not there yet as humans. So thank you very much. That's what I want to put out here.
All right. Thank you, Mr. Fatu, for that contribution, adding a voice to all Mr. Julius has spoken to us about. Thank you so much. So before I call on Mr. Joseph, I want to take us online quickly to quickly read out some of the questions we have here. And that's from Orwell, right? Apologies, Orwell. So his question or our question is, how has clarity in identification of roles and responsibility amongst enforcing bodies impacted OSH enforcement? How is assurance provided for OSH at state or national level? I don't know if you got that question clearly, Dr. Julius.
Yeah, thank you very much. And thank you, Fatu, for that beautiful addition. I mean, that's spot on. Well done. Okay, so this question I think is just relieving some of the things we have said. The clarity in identifying roles and responsibilities is within those enforcing bodies is not even the only problem. Is it not when you have the right numbers of people like inspectors who will go out and inspect workplaces to enforce those legislations, not just the right numbers, but also with the requisite knowledge to go out and enforce those things? That's when you even now start talking about clarity in roles. So we have inspectors that are not enough, number one. Then we have different bodies. If you come to like Lagos here, you have different bodies doing different things who still clash. Sometimes if you go to the scene of an emergency, you see different bodies struggling to take over as to take over as incident commanders. And this in itself creates a new emergency because people are, struggling to take over. One person wants to be the first to get to the press rather than ensuring that the right things are being done on the ground. All of these things have their own impact in enforcement. For instance, there was a time there was this back and forth between the Ministry of Labor and the office of the secretary, the head of service of the Federation. And that went on and on and on for a very long time about why should we come up with OHS desk in different ministries and agencies. So that's lack of clarity, yes, has created its own problems. But I believe that those things are gradually being put down as they had to now reunite so as to ensure that the Regulatory Board for Occupational Health and Safety has all of them covered. So the meeting that was called after the second hearing for that board had to do with stakeholders from all of these places, and they were all called into a meeting to unite for the sake of ensuring that health and safety, OSH practices and standards within Nigeria, this is speaking for Nigeria, within Nigeria are upheld and are seen to the letter. So that effort is going on, and we seriously hope it turns out for good for all of us.
Okay, thank you, Doctor, for your response to that question. One more question before I call on Mr. Joseph to ask his question or make his contribution. This is coming from Mr. Kennedy Idoko, the secretary for the district. It says, how can we be encouraged to advocate for safety or harness the hazard identification opportunity when someone who tried drawing the attention of relevant authorities to bad road was arrested?
Of course, these are discouraging factors. When you hear such news, it's very discouraging. But like we have all agreed on this call, what is discouraging is not enough because of our passion to prevent us from saving lives. So we need to just keep trying and keep making, it doesn't have to be one big place. Start making the mark from where you are. And sometimes what leads to arrest is that some people take the abusive part rather than the advisory part. So please, as a professional, when you go there, take the advisory part and don't have a political bias from where you are pushing your narrative. Push your narrative from a plain professional perspective, and you will hope to get some response.
Okay, thank you, Dr. Julius. One more question. Okay, no, I'll be calling on Mr. Joseph Joey to ask his question or make contribution.
Good afternoon, everyone. Standing on the existing protocol, I'd like to appreciate the host of this program and, of course, salute the effort of the organizers. Sincerely, what will not be enough to describe how excited I am having Dr. Julius here. Of course, he's not just my mentor, but he's my father when it comes to safety. It's just a question I want to ask for a little more emphasis. I think he spoke about gigs works being an opportunity, part of the opportunity in the safety world, right? So I might be a bit curious to want to have a little more about that, how practical it is when the core of our business as a safety professional is identifying hazard and hazard identification, and that's how we can work collectively to address and reduce the risk and ensure that everybody is safe. So begin to think around how safety professionals can thrive in their practice with gig work he spoke about. Perhaps you might want to cite some examples of how that can really be achieved. Thank you so much.
All right. Thank you very much, Joseph. For gig working, I just like to say that gig working is not what most people look at it as. Some people just see gig working as online work, finish. Gig working is, like I described, more like freelance, and where you do your work from home. You do your private, more like private practice from wherever you are, and then you can consult for different companies. You are not under any organization. You are just consulting on your own. So like I said, yes, you are more like freelance. So it's good for health and safety in the sense that someone can invite you on site to their site I do that. I like to do that once in a while, because a consultant that is coming on your site is using a third eye to look at your system as against you, who has been there on a daily basis. No matter how good you are, there are definitely some things you would overlook as a result of your daily interaction with that environment. So in that sense, a gig worker will help very much in identifying those things that you're not seeing. So that's a very good one. And it provides an opportunity for gig working in that light. So you can work from home like that, running your own show. If you have family engagements, you don't need to take excuse from anybody to go and attend to those things. You know, you can go anywhere you like, come back when you like. If a client calls you, you give them the time within which you finish their task, and you work very hard at it at your own, free time, not when you're under pressure by your employer to finish this thing in 2 hours time and come back to me. I want to see this on my table and all of that. So that's gig working. It's free. It's gives you more opportunity, but it has its own disadvantages, which is why, as a person, I'm not a big fan of gig working. The fact that it allows people to go and do their own medical, like their own HMO opportunity, allows them to go and do it as against what the organization will do for you, which is compulsory. The one you have to do by yourself sometimes, just sorry about that. The one that the organization does for you is compulsory, and so a lot of people have to do that compulsorily. But if you have to do it yourself, a lot of people cannot bring themselves to doing that. So it's very important that we see that that is one of the disadvantages. And then tax evasion is very easy with gig working because you are not under any organized framework. Some of the people don't even register their organizations, and they evade taxes. They don't pay tax. So that's another disadvantage. And if we continue, we'll go on and on and on. But gig working is good. So it has its own disadvantages.
Okay, thank you, Doctor, for your response to Mr. Joseph's question. As we begin to wrap up this session, I have a few more questions from the chat, which is from, one is from James Alemayo. And his question is, how can we effectively set up policies and organization? Are you there, sir? That's a question from James. And then another from Inye Allwell. Would you like to respond to that before I mention that from Inye Allwell Brown?
Sorry, I didn't get that. Can you take it again, please?
Okay, so I said there's a question here from Mr. James Alemayo. And his question is, how can we effectively set up policies in an organization?
Thank you very much. So, I mean, there are processes to set up policies in every organization, different types of processes based on the policies you want to set up. Most policies are triggered proactively in the sense that when you are thinking about setting up that organization, you think about that policy and it's compulsory that you must have it, maybe because the law says so or not. But some are spontaneous. Some of them are caused by existing situations. Like, okay, you have noticed that every day you find wraps, sachets of intoxicating substances around a certain place within your workplace. You have identified the need for that policy. So let's say the drug and alcohol policy, drug, alcohol, and substance misuse or abuse policy is not in your organization. The first thing you do is write an email to whoever is in charge, your head, as a safety professional. Maybe you have a safety manager or your CEO that you report to. And then, or you do this in conjunction with the head of HR in some organizations. You have realized the need to set up a policy. You begin a draft of that policy, consult with employees, and show that draft to management. When they agree to it, you begin to create awareness around the workforce and ensure that everybody within the workforce understands what the policy hopes to achieve and how it is in their own good, because people support what they help create. So if you allow them to support that process and be part of the process and be consulted, they will support it, and you are most assured that they will comply to a large extent, because they would also have seen the penalties for non-compliance to that organizational policy. I hope that sketchy response helped to put it in perspective.
Thank you so much, sir, for your time. Thank you for your response to the question. We are so grateful to have you on this call with us today and enlightening us with all that we need to know as OSH professionals. So we've come to the end of this session. and I'll call on Mr. Fachu to take it from here for the introduce next.
Thank you very much, District Chair. But before I go to the next item of the agenda, I would like to tell participants on this meeting that as you'll be exiting after the program, when you exit, a survey link will come up on your screen. Kindly endeavor to fill this for us. It's to help improve our processes and procedures with regards to how we'll come across to you some other time. So the next agenda on the